Welcome to this lesson. My name is Andrea Marini. I am Associate Professor of Cognitive Psychology at the University of Udine, and my specialty areas include the neuropsychology of language in developmental disorders and in adults. The lesson will talk about developmental language disorders, an update. Mainly, we will focus on three major topics. We will first talk about the characteristics of late talkers. Then we will talk about children with developmental language disorders, the recent consensus conferences. And we will talk about children with developmental language disorders, cognitive characteristics. Let's begin talking about the characteristics of late talkers. Late talkers, scusa, ho sbagliato. Vado indietro che devo spiegare prima cosa sono.
Andava bene, adesso lo abbasso un po', che altrimenti non ci abbiamo. Può accendere?
Ecco qua. Scusa per l'errore.
No, ma è normalissimo. Ha letto la slide, quando le do via...
Guardo in camera e spiego.
Spiega.
Mi dà lei il via? Late talkers are children with no sign of intellectual disability, genetic disorders, neurodevelopmental disorders, or brain lesions who between the ages of 18 months and 36 months are characterized by significantly lower lexical repertoire than normal. These children are quite interesting and important to study because they represent a high percentage of the normal population. Let's consider that international assessment studies suggest that the prevalence of this problem arises between a minimum of 11% to a maximum 20%. I will now tell you about a study we performed a few years ago together with colleagues in the Istituto di Ricerca e Cura a Carattere Scientifico, MEDEA, in Italy. In this study, we recruited 300 children of the target age. Of these, 33, so 11% were late talkers, as assessed via traditional assessment questionnaires. And what is interesting about the study is that we could find out what are the main risk factors for these children. For example, the first risk factor we found was a family history of language delay. A second risk factor considered the lower levels of exposure to reading in the families. And the third risk factor was a lower score on a task assessing, among other things, working memory development, which is the non-word repetition task. Interestingly, the same children were further assessed after 1 year. They were already 4 years old. And in this study, in these longitudinal studies, we found out that the same children assessed when they were already 4 years old were still in the lower range of normality on a range of lexical tasks, on a lexical comprehension task, on a semantic fluency task, and on a naming task. And some of them, a few percentage of them, was still deficient on an articulation task. This means that a small percentage of these children were still experiencing this significant linguistic difficulties after the age of 36 months. All those children who after 36 months enter in the range of normality are usually termed late bloomers. The other children, those who were late talkers under the age of 3 and were still having persisting linguistic difficulties after the age of 3, they are called, they may receive a diagnosis of developmental language disorders. So this is the first review question. Who are late talkers? Now let's turn to the second issue of this lesson. We will talk about children with developmental language disorders, the recent consensus conferences. Who are these children? Who are children with developmental language disorders? Actually, this is a disorder which has been described with different terminologies across the years. For many years, these children have been labeled with another label, diagnostic label, which is children with specific language impairment. Actually, we know now that this disorder is not specific at all. And there are some contributions to their linguistic difficulties that are linked to other cognitive skills. For example, working memory, executive functions, and so on. All these issues have been at the center of 2 consensus conferences, one an international one that we will discuss now, and the other one in Italy. Let's turn to the first consensus conference. We will focus on this paper. This is a paper entitled Phase 2 of Catalyze, a multinational and multidisciplinary Delphi consensus study of problems with language development, terminology. This study refers on the International Consensus Conference, where the authors decided to use the label developmental language disorders for these disorders. And the article is enriched by a flow diagram, which is very interesting for us because it allows us to guide us in the diagnostic procedures. Let's begin focusing on a child, and this child presents with difficulty producing or understanding language that affects his everyday communicative functioning. Well, the first question here is this specific child familiar or unfamiliar with the target language? In case this child is unfamiliar with the local language, for example, English in a child who lives in England, in this case we have to understand whether this specific child at home is significantly exposed to English language, because it could be simply that this child at home speaks another language, and therefore is a problem of exposure rather than a cognitive or neurodevelopmental problem. So in this case we might turn to his or her parents, or we might turn to investigations on his or her abilities on the other language, on the home language. If the specific child is competent in the other language, then in this case we will rule out the possibility of developmental language disorder. In this case, it's just an issue of exposure, and this specific child will not be enrolled on a developmental rehabilitation procedure protocol. So we might argue that multilingualism is not per se a major risk for developmental language disorder. Multilingualism does not lead to language problems. But what happens if this specific child is familiar with the local language and has problem, or is unfamiliar with the local language but then he has problem also in this specific language spoken at home? In this case, we might turn to possible features that are suggestive of a prognosis. We do know that prediction is particularly hard. Prediction of outcome is particularly hard before 3 years of age, but we do know some things. For example, we do know that children who fail to combine words at 24 months may have worse outcome than those who do not produce any words at 15 months. This suggests that it's not an issue if you don't speak out any word by 15 months, but it becomes an issue, it becomes a problem in case you do not combine these words around 24 months. Another potential risk factor that lowers the possibility that this child has a normal developmental, lower linguistic development is the fact that lower levels of social responsiveness and joint attention at 2 to 4 years may predict persisting social communication problems still at 9 years. And we also know that poor prognosis can be found in children with comprehension issues. That said, we also know that prediction of outcome improves between 3 and 4 years of age. We know, for example, that the greater the number of impaired areas of language functioning, the higher the likelihood that the problems will persist into school age and beyond. And we also know that sentence repetition is a relatively good marker for predicting outcomes and good prognosis of preschoolers whose problems are restricted to expressive phonology. This means that those children who have just articulatory issues and no understanding problems, no problems in lexical selection protocols and so on, these children are at lower risk of having persistent difficulties into school age. After 5 years of age, prediction of outcomes significantly improves. In this case, we do know that problems still evident at 5 years and over that age are likely to persist. We also know that children who start school with oral language problems are at risk for reading problems and poor academic attainment, and prognosis appears particularly poor when receptive language is impaired and when nonverbal ability is relatively low. In case a child, mi fermo, perché devo leggere, giusto?
Forse stiamo correndo un po' troppo.
Troppo veloce?
Sì. Quello che mi domando è, su questi argomenti che escono fuori,
Sì.
lei non ha da fare dei commenti un po' più lunghi o sono semplicemente definizioni?
Sono proprio bullets, sì.
Sono proprio definizioni
Non c'è un gran
così,
commento,
non c'è
sì.
un gran commento da fare. Ok, allora a questo punto direi di non crollare subito di velocità, ma
Ok.
perché siamo già a metà slide praticamente, perché siamo alla quarta pagina se non
Sì.
sbaglio.